ഇതിനെന്തോ ഒരു പ്രശ്നമുണ്ട്. തുടങ്ങാമോ അല്ലേ?
Yes, sir. Let's start, sir. Second. Namaskaram, all. A very good evening to all. It's a day 7 today, and the last day and last session of Vagbhata Sameeksha 2020. Today, in the introduction part, I wanted to mention a few points on Vidyabhyasa. I think it's very important to talk about Vidyabhyasa, especially in our point, Shastric point, where the education is getting diluted so much. So, anyway, the education was more about transforming than training in our country. It was finding out one's optimum ability through the whole process of learning. In an era where education is just another commodity, I think it's desirable to look into a famous conversation between Narada and Sanat Kumara, given in Chandogya Upanishad, about Satyajnana unfolding the Panchapada of Vidyabhyasa. It was a story I mentioned on the other day. I think I have got some time to narrate on it. Swami Vivekananda used to quote this in his discourses on education many times. In this narrative, Muni Narada approaches Bhagavan Sanat Kumara, seeking the path for Satyajnana. So at this moment, the sage advises him that Mati, logical thinking, is required for obtaining Satyajnana. Here the Satyajnana is the Tattva to be known. I think we can take it as the Shastra or anything that is to be known, that we can say as Tattva. Here, if you want to know Ayurveda, that is a Tattva. You want to know anything else, that is a Tattva. So anyway, you have to think logically. You have to have that Mati on Satyajnana, then only you can attain Tattva or Satyajnana. Then Narada asks how to get Mati. Then he says, for Mati, you need to have Shraddha. The Shraddha is nothing other than constant curiosity and enthusiasm. There is a concentration in the Satyavastu, that is which is to be known, has to be there. Then only you will have Mati. Then how to get Shraddha? To get Shraddha, you need to have Nishtha, Acharya says. What's Nishtha? Nishtha is absolute discipline. That is the second step of focusing, second step of concentration. There is another step. First step is there. So that is the first step is needed for Nishtha. So that is Kriti. Kriti is control over senses and the mind. Then only you can focus on something. Then only you can have the discipline. That is first step of focusing. And to have Kriti, ultimately one must have Sukha. The Sukha is the everlasting trust and hope possessed by the Shishya in his Guru or in the great tradition or in the knowledge which he is going to learn. The wisdom which one's Guru has. That is the Sukha. That is the one which brings the Sukha for the student. Then he will have Kriti. Then he can get into the Nishtha, then to Shraddha, and at last to Mati, and he will have the wisdom. This is the stages we used to attain knowledge in our ancient India, and it is called Panchapada. I think it's very important in the current day also in another manner. The same is mentioned in the famous quote, Shraddhavan Labhate Jnanam. Now, with that few words, I'll talk a few words about our Acharya, on whose remembrance the Sameeksha is being conducted. Padmabhushan Vaidhibhushanam K. Raghavan Tirulpadu. He was born on 20th May 1920 and passed away on 21st November 2010. In his 90 years of lifespan, Just a small PowerPoint is being shown in the background. You may look at it. In his 90 years of lifespan, we can identify a multi-talented persona, proficient in diverse knowledge streams such as Ayurveda, Samskrita, Jyotisha, naturopathy, philosophy, and a lot many more. He was a non-reputed public figure, skilled physician, environmentalist, ardent Gandhian follower, philosopher, expert columnist, and even a politician once. Uh, his unique way of understanding and explaining the Shastra made him a hub of wisdom in his time, bringing out many brilliant scholars, disciples from him. He has written around 40 books in various topics. Among that, a commentary on Ashtanga Hridayam, on Rasavaisheshika. I think the Ayurveda community is very fond of such granthas, published articles and delivered authentic discourses on Shastra all throughout his career. He will continue to motivate us forever with his timeless teaching, writings, and through the Shishya Parampara he initiated. Now, Tirumulpar Foundation is a platform to discuss Shastra in its original context, founded by our Gurunathan only. Foundation is exclusively acting with a mission to preserve the originality of Shastra and to propound it among the upcoming scholars and in the general public. And Vagbhata Sameeksha, a unique Shastra Parishad, where intensive discussion on the basic principles of Ayurveda is being conducted, and it was conducted as a two-day program previously. This year we are conducting it as a 7-day program in the national level. And in the evening sessions, we are conducting Tadvidya Sambhasha, conversations on Sarvaroga. It's a main theme topic. And it's designed in such a way that there will be two experts sharing their valuable experiences, and the whole discourse will be moderated by a skilled discussant. And on the as it is the last session of the year's Vagbhata Sameeksha, there will be a concluding ceremony after this session. So please stay with us even after the session and send and let us know the valuable feedbacks on that occasion. With that, let me introduce our panelists for the day. On the Tadvidya Sambhasha on the topic of Rogamargas and exploration. First of all, I introduce Vaidya K.T. Jayakrishnan sir. Sir has completed his graduation from VPSV Ayurveda College, Kottakkal in 1986. He was a professor at a great Ayurveda school, Coimbatore, established by the legend late P.R. Krishna Kumarji. Later, he served as professor and medical superintendent at SJS Ayurveda College, Chennai. He is currently working as the chief medical officer at Ayurveda Pharmacy, Chennai branch. He has presented papers in many national and international seminars as a research person. He is well known for his firm and exceptional understandings in Ayurvedic philosophy, its basic principles, and their application in the clinical practice. I humbly invite Vaidya Jayakrishnan sir to the Sambhasha. Welcome, sir.
Namaskar. Namaskar.
Now, our next expert is Vaidya Ravishankar Pervaje, sir. I think he need not introduction among Ayurveda community. After completing his graduation from SDM Udupi, he secured his post-graduation on Chalya Tantra from BHU Varanasi. And he is the founder of and managing director of Sushruta Ayurveda Hospital, Puttur, Karnataka. He developed an effective Pratisaraniya Chara for the treatment of ulcers, which is now known as Parvaje's technique of Chara Karma. And his treatment is purely based on Karyakarana Siddhanta with the Dosha Vikalpa Pariksha and Rogi Roga Pariksha in pure Ayurvedic manner. He's a busy orator, delivering sessions all over India on theoretical and practical aspects of Ayurveda. Pervaje sir himself has disclosed many times that his Manasa Guru is Tirumulpar sir, and that the commentary on Rasavaisheshika written by Tirumulpar sir has helped him a lot in building his base in the Shastra. He is one among the great gurus of RAV, deputed by Ayush Department. He is guiding disciples from all over the country, both formally and informally. Now, I cordially invite Vaidya Ravishankar Pervaje sir to the Sambhasha. Welcome, sir.
Namaste.
Namaste. Now, our discussant for the day, Vaidya Sethuraj K.S. He has completed his graduation from Government Ayurveda College, Thiruvananthapuram in 2002, obtained his post-graduation on Shalyatantra in 2010, and secured another post-graduation on Ayurveda Siddhanta in 2014. He started off his career as a tutor in 2006 and he is currently working as associate professor in the Department of Samhita Siddhanta at Government Ayurveda College, Kannur. He is known as an ardent follower of Sri Vaidhyabhushanam K. Raghavan Tirunulpadu and is a part and parcel of Tirunulpadu Foundation. His humility, inquisitiveness, dedication, and understanding of Shastra on the basis of Guru Tirunulpadu's lectures make him a unique teacher. I happily welcome Sethuraj K.S to the Sambhasha. Welcome, Sethuraj. With a prayer to our great Guru Parampara to enlighten our Pratna, I invite our panelists to begin with the session, and I am handing over the dais to the discussant. Thank you. Namaste.
Thank you, Vaidya Om Prakash. Chaturmukha Samarambha, Vagbhata Jari Madhyama, Asmadajari and we are indeed blessed today to have some of the two of the best or most prominent Upasakas of Ayurveda Shastra. I have used the term Upasaka because they have a total or perfect balance of both their depth in the philosophical background or the scientific basis of the Shastra, as well as they are very successful practitioners also. And for the last 6 days, we have been having discussions over the various aspects of Yoga Samparapti. And now, finally, on the concluding day of the entire process, will be the central topic of today's discussion is our discussion or the discourse on Marga. I would like to present the way we have planned this session for today. This session has been designed in 3 sections. In the initial section, we'll be going through, we'll seek the opinion from our respected panelists on the various fundamental aspects of the concept of Rogamarga. And after having received or heard the different opinions of both of the panels, we'll be next moving on to the practical aspect, which will be explained in detail, for which aspect both of the panelists are very rich in their experience and their basis on the science. And finally, on the third section, there will be the opportunity for the members of the assembly to come up with some of their points or point of view, and to raise some questions or to proceed with some healthy discussion. So finally, for a Sambhasha to be very productive, there has to be the successful discussion happening. And so and before inviting the panelists for the discussion, I very humbly request all the members of this assembly to mute there will not be any impedance to the presentations. And now moving to the topic, this is the concept of we all know the Bahir Rogamarga or the Shakha, and then there is the Abhyantara Rogamarga or the Kosha, and then there is the Madhyama Rogamarga. And see, we have primarily classified the Dehadesha into Shadanga, and then there are several other classifications of these Dehadesha. And there comes a question. Initially, we are presented with a confusion as to why or what is the need for a classification as into 3 as the Shakha, Kosha, and the Madhyama Rogamarga. And with all respects, I invite Dr. Jayakrishnan sir to speak out his concept or speak out understanding on the topic, and to enlighten the assembly. Sir, please.
Thank you. Gurubhyam Namaha. Let me first thank you, the organizer, for having invited me to this event of discussing the Shastra. Am I clearly audible?
Yes, sir. Yes.
Yes, sir.
Yes,
Yes.
sir.
Yeah. So, event is organized in the name of late Sri Raghavan Tirumapad sir, with whom I didn't have any direct connection. Even otherwise, I think I have come across with him and happened to be among the audience on two occasions. One is when he visited Kottakkal Ayurveda College when I was a student, and his book on Ashtanga Sangraha. I need to mention that because I belong to a batch where the BMS was first introduced in India, rather implemented in Kerala, and there was a lot of confusion. You know that when you come across these new books, new topics, new teachers, new style, everything, a sudden change where Ashtanga Sangraha was introduced, and many people were more familiar with only Ashtanga Hridaya. So that was a time when we got a book written especially in Malayalam language from Tirumala Sir, and he visited the college also that time. Second time, he was honored with an award from Ayurvedic Pharmacy Coimbatore, probably I think 94, 95, I don't remember exact year. That time I was there in this organizing that function and interacting with him. These two occasions I have been, I think, in touch with him. So very great honor to be a part of this discussion in the memory of late Raghavan Tirumapad sir. Coming to the point of today's discussion, I know that we are talking about the Shastra, to my opinion, which is slightly different from the science. And any medical education, we all know that courses or study will be generally divided in such a way that we create an idea about what is the normalcy of body, what are the normal functions. If this is clearly understood, then only you can think about what are the deviation from normalcy to be known as diseases. These two knowledges are well connected to what we are going to do in the third phase of this study, that is the treatment. So our Shastra also has got this kind of an understanding, or rather it has to be understood from this angle to see whether we know the body clearly. Based on that understanding only, we are going to have a clear picture of what is a disease, and this knowledge will be utilized when you think about a medicine. I don't say medicine, it's a treatment or it's a management of the situation using your intellect. So from that angle, this discussion is basically about Yoga Vijnan Nidhanam. Into that, how much these topics are contributing. So I always used to say that we know the body is nothing but tridosha. Okay, dosha, dhatu, mala, mula. So body's understanding is based on tridosha. Medicine's understanding is tridosha. Disease is understood in terms of tridosha. Treatment is understood in terms of tridosha. So this tridosha understanding is the most important part with which we try to understand what is the body. So tridosha understanding is definitely connected to the base of philosophies, or rather the Panchabhuta concept, which is only for an understanding I am mentioning. But what is working in Panchabhuta is, or what you understand out of this Panchabhuta conglomeration, the whole universe or the body. What is reflected is known as tridosha. So the structural constitutional understanding is Panchabhuta. In a living body, this Panchabhuta, from the gross to subtle, whatever is reflected, that is what is known as tridoshas. So from the gross, to the subtle, the body is getting disintegrated. Everything is getting disintegrated. So we also say chiyade anena iti sharira. That which is continuously disintegrated is body. So what is getting disintegrated is the gross part of the Prithvi and Jala, to be known as Kapha. Disintegrating mode is Agni dominant period of Pitta, and disintegrating stage is Vada dominant, Vayu dosha. So these three are representing the changes happening in the body right from birth to death. This is what we are concerned with. So right from birth, you have the disintegration starting, and at the last moment of death, there also you have the disintegration getting completed. So if you have to have a smooth disintegration process, you need to ensure that the Kapha, Pitta, Vata are interbalanced. This is what we say. We know bodies are continuously disintegrated. You can't prevent it. As long as the disintegration process is smooth, we call it as Satmyam. Disintegration process is smooth, it is Satmyam. Whenever that disintegration process is disturbed, it appears in advance, then that is known as a disease actually. So disintegration process is a functional plane. The structural plane in the deeper level is Panchamahabhuta. So in a living body, what is the gross structural plane? It is nothing but Saptadhatus. It is a Saptadhatu which form the platform for creating health as well as disease. It is a structural platform, even though it is not static, it is continuously changing from Rasa to Shukla Dhatu. So this continuously changing Parinama Mabhatyamana Nam Dhatu is changing platform forms a structural plane, an anatomical structure on which you visualize the changes in terms of Kapha Pitta Vata. So Kapha Pitta Vata concept is a deeper understanding of the structure. When you say Dhatu, it is a gross understanding of the structure. It is Dhatu which is being provided with the gross structural identity of the body. But changes happening in the Dhadus are understood in terms of Kapha Pitta Vata. So Kapha Pitta Vata, we all know that they are partially opposite to each other. Kapha is gross in nature, Vata is subtle in nature. Kapha is Snigdha Shida in nature, Vata is Shida Ruksha in nature. Pitta is in between with Ushna Ruksha. So there is a partial opposite nature to the base structure of Kapha, Prithvi and Jala. Matter is Prithvi, everybody knows. Other Jala is added, it becomes life. Is maintained with the Ushna nature of Pitta, so that the Vayu movements are happening throughout the body. Vayu movements are responsible for transporting the nourishment, even a transformation from Dasadhatu to Raktadhatu. It is a movement, even a growth is an expansive movement. That's why we give a lot of importance to Vayu. We say Vayu is most important. In the deeper level, Vayu is there. So that is how the structure is concerned. So we have to say this structural identity is more concerned with Kapha. Its nourishment and changes are made with the help of Pitta, so that movements inside the body is smoothly conducted. Even then, because it is partially opposite, there is a process of disintegration to the Kapha dominant structure of the body. So our concern is this is the functional understanding of the body. Kapha Pitta Vata is a functional understanding. But we need a platform, a structure on which diseases can be expected. Diseases can be manifested. Difficult symptoms can be expected. So you need a structural platform. That is nothing but 7 dhatus. So to speak about what is the normalcy of the body, we have been given different definitions to understand the body in brief. This is the nature of a Shastra. Everything will be briefed to your level. Wherever you need, you will be able to expand it according to your need. So in the short form, if you understand what is the body, then you can extend it to any level that you may require while dealing with the diseases. So what you say, comprehension to our level and then expansion to the greater level, magnification to the greater level. So here body, for example, body is told as a Kayo Agni. One angle, if you just speak, body is just Agni, which is responsible for disintegrating the food so that the nourishments, basically the snigdha content of kapha, reaches every structure in proper way. So deeper level, you call it as Dhatu Agni. Again, deepest level you say is Bhuta Agni. So sthanasteshu kayagniratnisha amshaha dhadushu samsrita Dhatu Agni. So the Agni is functionally working proper. Then optimum Agni is equal to health. So you get the overall picture of how the dhadus are transformed, how that is utilized in the form of ojas for doing your activities and all. Like that, we say dosha dhadu malam. Body is just dosha which are working on dhadus excreted as malas. So technically speaking, this is body. In that way, specifically, we know that diseases, various types of diseases have to be mentioned as an example to understand how these kind of deviations can be managed. It's the entire purpose of Ayurveda. For that purpose, we have a different description of explaining the body as Shakha and Koshta and Madhyama Rogamarga. Different doshas, vitiators can travel through these areas to create different diseases. So this is actually the purpose of explaining the manifestation of disease, or we can say the samprapti of the disease, to understand how these are getting manifested, difficulties are created. For that purpose, an anatomical description is given. That is what is known as Shakha, Koshta, and Astimarmas. Rather, I put it as Koshta, Shakha, and Astimarmas in the practical point, or rather, it has described Samanya Samprapti. It is more like Koshta, Shakha, and Astimarma. More than to this understanding, we all know that body is nothing but the food, as I described, Annat Bhutani Jayani. So the food is your body. This is a different concept in the Western science. For them, there is a body, you nourish wherever it is needed in different ways, like carbohydrate, protein, fat, different things. For us, body is what you eat. So from the body, how that nourishment is getting divided into different ways. Once it enters into the body and subject to Agni, it is partially disintegrated and it is subjected to Vipaka. We all know Kapha, Pitta, Vata, kind of a Vipaka. Madhura, Amla, Kadu Vipaka. With these changes of digestion, Kapha related Snigdha, Shida gunas are transferred. Then Pitta related Snigdha, Ushna gunas are transferred. Then Vata related Shida, Ruksha gunas are transferred into the body in the normalcy. This is how rather body is completely maintained, or this is the only way where you can maintain the functional plane of the body, wherever the structure, whatever the structure is there. This is how the normal digestive process is happening. We know that it should be Shad Rasa dominant food, where Madhura Rasa should be the dominant factor. That is what is suggested, just to improve the structure which is Kapha dominant, whereas other doshas are supplemented with the Kadu, Amlam, Pitta, Kashaya, as salt. So Kapha, Pitta, Vata formation or maintenance in the normal body is done through the the Koshta. So normalcy is maintained through the koshta. So whenever there is a deviation from normalcy, we need to look into the koshta basically, which is well connected to what you are eating. So most of the occasion we know that the disease is an extension of what we say the food and activities, ahara and viharas. First one is ahara. This is the reason for that. So the doshas are maintained regularly from the koshta. And if there is some variation, some levels of doshta, first we need to look into the koshta, and which is well connected to Agni. This is how we look at it. So to understand the deviations, or what to say, the samprakti, I put it into a knowledge where it can be in the treatment process. We need to have an understanding of what is the normalcy of the body, how the dhadus are nourished. So the koshta becomes a base from where the doshas are maintained. Whatever is formed in the body, it is nothing but rasa to sukra dhatu. When these transformations are taking place, especially the kabar-related snigdha content, unwanted snigdha is being pushed out. It is precipitated, and the pure snigdha is progressed. It becomes more potent as it becomes the sukla dhatu. The potency is more, the volume is less. So unwanted snigdha is removed as mala, basically through the urine, mutrasya kledavahan, then through the sweda also. And the food waste is removed as the purisha. So that also has its own role in continuously removing the waste material. We know that the kleda content is more formed due to lack of digestion or accumulation of nourishments. We call it as prameha. So to understand that prameha, you need to have a picture of what is happening in the body, in the functional plane and the structural plane. So just to say that a different concept of how body structure is maintained, how doshas, which are responsible for everything in the body, how doshas are maintained in the body, how these excrete, malas are removed from the body. This will be an essential understanding. It's a knowledge. It's not the structure. How you know the structure. So it is a knowledge with which you get the insight into what are the different ways diseases are formed. So that I think that part I will have it in the next part with these few words. I think please I would like to know the opinion of Dr. Pervaje sir as well about this Koshta, Shaga and Astima.
Thank you, sir. Thank you for your profound deliberations. Now, sir, I request Pervaje sir to come up with his concepts and with his understanding of the topic so that the assembly will be enlightened.
First of all, Shri Gurubhyo Namaha. Am I audible, sir?
Yes.
Am I audible? So, Shri Gurubhyo Namaha. First of all, I am thankful for giving this opportunity to share my experience in this platform, a beautiful platform, and we have very good orator in front of us. So about this today's discourse about Rogamargas. So what I am saying is, you see, our body is a spherical structure, a sphere structure with the two openings above and below. So in between there is a full srotas that we call as mahasrotas. Around that there is a structure of all materials and outer structure. So one is bahya, one is in the middle, and one is mahasrotas in between. So this whole body comes here, and then the two shakas, from 4 shakas, and above one opening with the head, it is there. So in this body, all the functions are going on, in the body, physiological function. Already, sir has had a detailed discussion about it. So I don't want to go for all these things. So in this body, doshas do all the work. When they're in the samya avastha to prakrita doshas and vaikrita doshas are samya avastha, this vaikrita dosha do all the work in our body, as you all know. So when that is why in Ashtanga Hridaya he says, Kalartha karmana yogo hinamithyati matrakha, by this deviation. When it is sama is there, it all nourishment works and all the work is going on in our body. When Kalartha karmana yogo hinamithyati matrakha, there will be derangement of Vaikrita dosha from Prakrita state, Prakrita level. So that causes different diseases. So that is why he says prakopa, prasara, stan samshaya, like that kriya kalas are told. There was a good discussion the last 4 or 5 days about all these things. This doshas do parisarpana, yatha dushtanam dosham, dushta dushita, cha anuvisarpa does all our body and get somewhere it is nivrutti, sthana samshaya occurs. For that, our acharyas has done these 3 classifications. Rogamargas they have told, Bahya Rogamarga, Abhyantara and Madhyama Rogamargas. They have mentioned different organs in all these things. So it is actually Sthana Samshaya where it occurs. Where there is a Kha Vaigunya, there will be Sthana Samshaya. As you all know, for getting a disease, this Prakapita dosha should get Sthana Samshaya anywhere in the body, then there will be formation of a new entity. So just like father and mother should join together, you will get a new organism, a new entity. Like that, father is doshas, mother is all this Sthana Samshaya, Kavaigunya area, or you can say this Rogamargas, all these. Wherever Sthana Samshaya occurs, you will get that particular Vyadhi. Wherever this Sthana Samshaya occurs, Kavaigunya occurs, so it will have its own signs and symptoms. That is, according to that, you will have a specific Vyadhi. So Vyadhi's Pratyatma Lakshana will be according to Sthana Samshaya, in which area it occurs. Pratyatma Lakshana, according to Kavaigunya, where it occurs. By which dosha Kavaigunya has occurred, like that will be there. So this dosha does get Sthana Samshaya, get a Vyadhi, you will have both Pratyatma Lakshana. According to Pratyatma Lakshana, you can say this is this Vyadhi. For example, when Kavaigunya occurs, that Tiryagata area in Shiromarma, you get a Pakshagata. When Prakupita gets Sthana Samshaya to Gridrasi, you will get a Gridrasi. When it is Sthana Samshaya, it is Asti Gatavata, like that. Vyadhi Pratyatma Lakshana will be according to Kavaigunya, that particular Rogamarga, that area. According to dosha, you will have different signs and symptoms in that particular Vyadhi. By seeing this dosha and Vyadhi Lakshanas, you will give the treatment, Anuktamapi or Uktamapi, you will give the treatment, dosha, Vyadhi, Viparita, Chikitsa. So for giving a specific treatment, I think this understanding of Rogamarga is very important. So that is why our acharyas, after explaining all these doshas, then Kalartha karma yoga hinimatyati matraka, by this dosha prakopa, then when it gets Sthana Samshaya to be different Rogamargas, then he explained different signs and symptoms of different doshas in Ashtanga Hridaya Sutra Sthana. I think this is my understanding. I hope I have answered your question. Let us go for further, start to further questions and answering session. Okay.
Thank you, sir. Thank you for enlightening words. So far, we have come to an understanding that the Rogamargas serve as the basis for the manifestation of diseases. It is actually the vitiated doshas. They require a site for their manifestation, and it's on the basis of the site or the platform that is provided for the manifestation that the manifestations become diverse. and a proper understanding of the base upon which the Visheta doshas present themselves helps us in devising the required management, that is strategy that has to be adopted for the management of the diseases. So this so from what the disease happened, it has very profound. Jayakrishnan sir had started right from the basic concepts and the basic concept of the body and how and why a concept of Rogamarga is required, and that was ably complemented by Pervaje sir, who elaborated upon the need for the understanding of the Rogamargas for devising the necessary treatment strategies that are required to be done. And now we'll move the basic consensus that has been arrived is that it's essentially a part of the body. It's essentially a part of the deha, and they have been classified on the basis of their based on the role in the manifestation of the diseases, and they are essentially required for the design of the management of the concerned rogas. And now it's a time for us to seek the experience, and that is an area where our eminent panelists are very rich in their experience, and they've had diverse experiences. And Pervaje sir has had his specific experience on the basis of his Shailatantra background also. Yeah, in the very beginning, I again invite Dr. Jayakrishnan and sir to experience of the understanding of Rogamarga in his clinical practice and how it has helped him in devising the necessary or successful treatment. Thank you, sir. Sir,
please unmute.
Sir, kindly unmute your.
Okay, sir. Yes, audible, sir. Audible, sir.
Yes, sir. Yes. It's also.
So the Rogamargas, I think, have been basically explained, and everything is rooted through the Koshta, which is the longest passage. We all know that as per Charada, Srodomayam Idam Shariram. If your food has to digested food, essence have to reach every nook and corner of the body. The entire body must be remaining in the form of passage, Srodas. That's very clear. That's why we say there is a body is completely Srodomayam. Everything is remaining in the form of passage. Like we say nephrons, even neurons can carry the dendrites can carry the nutrient materials, So everything is remaining as a passage according to Ayurveda. In that biggest passage is Koshta, that is responsible for maintaining Kapha, Pitta, Vata in the body. And the movement of Koshta, it is not the Koshta, it is a movement of the Koshta has to be there right from birth to death. This 6-meter tube, we know that it has to move, the peristaltic movement has to be continuously remaining there right from birth to death. And this movement is transferred to different parts of the body. This movement is responsible for taking the nourishment to rest of the body. Okay, when the nourishment, what is known as a snigdha content, which forms the structure, Kapha property, when that is transferred to the body, you get the transferred stuff transforming into a part of the body, which is nothing but dhadus. When dhadus come together to perform a very important function, important vata function, you call it as organs or even marmas. Like joint, you say joint is not bone alone. We know bone, ligament, synovial membrane, synovial secretion, arteries, veins, ligaments, nerve endings, everything put together only you call it as a joint. Visible part is a bone. So definitely a joint will be more important for Vayu than any other doshas. So structure, whatever be the structure, a better, stronger Vata function is performed in a joint. So we say it is an important part. Asti Sandhi, or even it can be a marma, where the Vata is prominent for its function. So this is how it happens. Structure is almost like we call it as tissue. Organs are almost like marma, which is more important for the Vata-related functions of movement. Structure is only like a tissue, and this is basically maintained with what is happening in the Koshta. So we know that Samanya Samprapti, as explained by Vagbhata, I think everybody will be familiar with that. First aspect is that dosha, dushta, rase, dhadun, dushin, ubhe, malan, ado, dve, saptashirasi, khani, sedavahani ja. Mala, malayanani, syur, yadasun, keshwadogadaha. So disease starts in the srodasas. Keshu is a kha, is a srodas. What you see in the gross plane as a disease, it should be starting in the srodas, then it is expressed in the gross plane. So even in the srodas, we need to find the role of Kapha, Pitta, Vata. You just take a passage, in that gross part is the wall of the passage, which is nothing but Kapha related properties. Nourishment is passing through these srotas, and then and there it is added to that. The snigdha content is added to the wall of the srotas, where that snigdha is broken down by the Agni present there. So there is an Ushna element. The movement of this nourishment, the snigdha content, is felicitated by the mechanical force, what is known as Vayu. So even in a srotas, you can visualize what is Kapha, what is Pitta, what is Vata. So the derangement or the interbalance is disturbed at this level, then it is happening, it is manifested into the gross plane. Derangement is nothing but a difficulty for the movement due to the weakness in the structure. We must remember that we underline the movement or Vata, we give more prominence to the Vata condition than the gross plane of Kapha. When the Prakriti is explained in Ashtanga, we know that 8 Prakritis are told, then immediately Vagbhata says, Vibhuktva, Dashukaritva, Bhuvutva, Anyapapana, Swadandriya, Ukudoshatva, Doshanam, Pravaroni. Why Vada is important is Vada is responsible for all the movements, including movements of rest of the doshas. When Vada movement is impaired, you call it as a function is impaired, and this is what is the initiation of the disease process. So Vada movement we felicitate if the nourishment is properly given and the structure is sufficiently unctuous. That provides a smooth Vayu movement. So Vayu movement is impaired, we say function is impaired, is the beginning of the disease process that starts in the srodasas. Specifically speaking, if you are talking about what is the role of Vada, what to say, Koshta, Shaka, Astimar. Vyayamat, Ushmana Taishnyat, Ahida Acharanadavi, Koshta, Shaka, Astimarmani, Drudatvat, Marutasya, Dosha Yanti. These are doshas are traveling. Sodomuga Tada Tebya, Sodomuga Vishodana, Pridya Vishyantana, Kostam Pagat, Kostam Vayustamita. This is what is generally known as a Samanya Samprapti, how the disease is manifested according to Ayurveda. So Vyayama, Ushmana Kaishna, Ahita Acharana. What we say, Ahara, Vihara, whatever be the causative factors, you need something strong, something Krishna, Ushna, like a strong exercise. It's a strong activity, something strong you need, which can push the doshas in excess from the Koshta to Shaka and Astima. That is not sufficient to create a disease. So doshas can travel in excess from the Koshta to Shaka and Astimarmas due to an excess activity, is a strong activity, maybe a strong food, strong food, can push the doshas. Normal travel can be pushed further So it can go to Shakha and Asthimurgas. If there is no weakness in that particular structures, organs, it cannot create a disturbance there. It remains there. It is subjected to Pagam after some time. It cannot disturb. It has to come back. Otherwise, we say Abhishyandana. It remains there for some time. It gets melted and it flows back to the kosta. Third option is that it is the Vada nature of movement, we say peristaltic movement, which is responsible for this travel. That Vayu nature is reduced in the kosta. You bring the Anulomana in the kosta. That mechanical force which has pushed the doshas will be having a drawing back effect into the kosta. Kostam Vayostamika. This is how doshas are traveling and coming back in the normalcy. If at all any structure is overused or underused or wrongly used, this is what you say, what you say, Adiyogam, Nitya Yogam, Hina Yogam. Organs are overused. You are sitting for continuously 10 hours, 12 hours, and nowadays we know shorter people. Naturally, your back muscles, backbones, blood vessels carrying nourishment to that area, all are subjected to strain. It becomes gradually weak if you don't give rest and movements to that area. So over a period of time, the nourishment going to that back will be gradually restricted. It's not happening one day. Over a period of time, that area is getting restricted. Then on one occasion, on a strainful movement, sometimes you get a disc being prolapsed, where the bones are degenerated, disc is degenerated, we call it as. So how we are looking at it, this is a very important area where, you know, in Vata Vyadhi, majority of Ayurvedic people are dealing with Vata Vyadhi. Vata Vyadhi diseases are definitely not well managed by other science. So naturally it has to depend on Ayurvedic practitioners. So in Vata Vyadhi, if you just look at the Nidana, we understand Vata provocation Nidana, Stitoshna, Kashayalpa, all those things, Hina, less food or overfood, Adhyasanam or Nityasanam, everything, whatever is there, which ensures that the structural health is not properly there. Beyond that, overactivity, and then we know the most important part, which we should be aware of, Kriya Karmas which are not done properly. We have a lot of things to ponder upon these areas, Vasti or Virejanam or Vamanam, whatever is done without knowing the structural health of the body, precipitate Yuksha nature after this Shodhana, and in later due course of time, this Yuksha nature of Vata can be creating a problem. So, Kriyas done on an unusual way, improper way, can provoke. Then again, the most important part, diseases like, which we usually ignore, diseases like Arsas, Adisaram, Grahani, Gulmam, Pandu kind of diseases, which continuously precipitate the Vata form of atmosphere in Dhadus. Typical example is Arsas. Arsas is very important because, not because of the bleeding or the mass precipitated there or the pain related to that. Arsas implies that the proper downward movement in the kosta is obstructed by a physical growth, fleshy growth. So it is a force, it's a mechanical force which has to go down normally. That is obstructed, it can get diverted in any planes where Samana Vayu, Vyana Vayu, Udana Vayu, Prana Vayu also can be gradually disturbed. So it can go even into a disease of mental plane also, to my understanding, because the basic symptom of Arsas is Anavasthidattu. Anavasthidattu as per Vagbhata. Anavasthiti is restlessness, not because of this problem of bleeding we are concerned. restlessness, which is a symptom in the plane of mind which is traveling with prana vayu. It can be easily affected if the vayu course is reversed. So then you can have a continuous disturbed feel, which may not be a disease, it can turn into a disease mode also. If you are restless, irritable, slowly it can turn into a disease mode also. You are viable. So in that aspect, the importance of vayu in the Koshta is mentioned. So we go, many occasions we go wrong when we treat a back pain with the vasti. If there is nurses in the background, you are not supposed to do vasti, or you have to be doubly careful to do it. If you have a Grahani history, you cannot do it. It may provoke the Grahani weakness, or you don't get the desired result. So it's that kind of things. I don't know how far we are seriously looking into these aspects to understand. Vada Vyadi Nidanam, your concern is L4, L5, everybody can identify nowadays. Even you can imagine, Ayurveda concern is that how this person has got this particular way. How the L4, L5 is disturbed in this particular individual. If you draw it back, it can be because of various reasons, different reasons for different people. Accordingly, our approach also has to be changed. Medicine has to be changed. If somebody is having a vada difficulty due to ursus, an abhyarishtam will be the best medicine to create vada anulama. Somebody having gulma, sometimes a hinguashtaka churna or what you say ashta churna or hinguvajadi or vaishwanara churna will be a supplementary medicine to create vata anulama in it. Somebody is having a prameha, where you see that all dhadus are always in a weaker condition. He is getting a back pain. Sweda is contraindicated. But for the Vyadi, you have to do Sweda. So where you are doing Sweda, the Ushna content, you have to be minimizing. If there is a background of Prameha Vyadi, Sweda is contraindicated. Another important disease which we don't recognize is Pandu, where also Sweda is contraindicated. Somebody having a Pandu is not anemia. Much more than that. Its implication is that Alparakta Medaska. So all dhadus can be subsequently weakened. Always you have dhadu trayam, always there is a vada atmosphere. Very easily you can have a vata vyadi. While treating that snehanam, swedanam, when we do, swedana has to be restricted because background is Pandu. So swedana restricted, even in medicines you can do it. You have a lot of options for vada, which represents the snigdoshna nature. Like you have a Rasna Vikashaya, you have a Rasneranda Vikashaya, you have Rasna Yogarajgulu, which is hotter, Maharasna Yogarajgulu is further hotter. So based on the understanding of the dosha and its related gunas, you can have a grading, even medicines. Swedanam you are doing, you have Patraporla Swedanam, which is a medium hot. You have a Churna Sweda, which is hotter than Patraporla Swedam, Shashtika Pinda Swedam, which is less hotter. You can decide upon the grade to get an exact result on that. You are using a Thaila. For example, Cotton Zukaji Thaila is very hot. Sahajraj Thaila is not that much hot. When you come to Dhanvantara Thaila, Narayan Thaila is very, very medium hot. So you do a Amshamsha Vikalpana in dosha as well as in the medicine to exact a accurate result. The other day, I think I heard that Murli sir was talking about Anandyam Taratama Yoga Descha Yata. The dosha gradations are explained in 64 and its multiples. Nobody can specifically say this much vada, this much pitta, this much kapha, because that possibility is innumerable. The human mind cannot do it. So what you do, you need to comprehend and say, now Ushna is needed. You can express that in words. We know sugar, jaggery, honey, everything is sweet, but it is not same grade. Everybody knows. By way of using it continuously, you understand what is the difference in this gradation. So what you are doing in these conditions are just comprehending the dosha gradation to your level, or rather gunas into your level, bring it down and then use it accordingly. When Vagbhata speaks about Rakta Moksha, we know that he says whenever your Snigdha application, Ruksha application, Ushna application, and Sita application are not producing result, you go for Rakta Moksha. That means whatever we are doing is basically a Snehanam or Rukshanam, its opposite. And it has to be supported with either Swedanam, which is Ushna induction, or the opposite, Stambanam, which is Sita induction. The combinations and permutations of all these four are being done in all treatments, because body is basically Prithvi, Jala, Agni, Vayu in the space of Akasha. So these four properties represent actually these four. Its increase or decrease creates imbalance when we are doing this. So whenever we do it, you need a gradation which is done in the mental plane, not in the physical plane. You ask people whether you feel Ushna, you don't mean the temperature. The feel you are meaning, temperature may be same. Snigdha is less, you feel unnecessarily hot. After a Jwara, Jwaroshma, we understand. Jwara is cured, you feel hot for a few days. And strong Jwaras like typhoid and all, you can feel hot for 1 or 2 months. Chickenpox and all, we feel hot body, sweating and all for a few weeks or months sometimes, where the Pitta background is very strong. So it is not the temperature, the feel of Ushna, where the Snigdha is reduced, you feel it prominently. So that kind of a gradation we have to do from the plane of mind, from the feeling. This is where Acharya says, Adurasya Andaralpmanam Gatva. The patient's feeling you are trying to understand, patient's experience you are trying to take, not in the physical plane. Our science is more subjective, it's not objective. But even the moment you say dosha, it is a subjective feel. It's not objective alone. Objective is more superficial. Deeper we go, and from the plane of mind, you try to feel what is happening. Then, what is the requirement? First, the physician has to have a balanced, quiet mind to comprehend these things in the plane of mind. That is why the other sloka, Janiyan Avahida Manasa Yadaswan. Physician has to be Avahida Manasa. A balanced, calmer, quiet mind. You can calculate what is happening. You can do the gradations. Accordingly, you can go for treatment. See, in Vada Vyadhi, of late we know that, you are not very confident of doing Vasti, rather we are more confident doing Kadivasti. I always used to say, when we suggest, I'm not against Kadivasti, Kadivasti will yield result, that is there. But when we say Kadivasti as the main treatment, our understanding of the body is based on anatomy and physiology. More dominant with anatomy and physiology. So you don't think of doing a Vasti will produce result. You don't think of it seriously. When we say Vasti or Sneha Vasti is the better thing to be done after doing Sneha Sweta for a few days, then your understanding the body is based on this Koshta, Shakha, and Astima. Because Vada disease, you assume that Ruksha, Sida nature is there in the body, somewhere. Can be in the Koshta, it can be in Shagas. In the deepest part, we say, where the movement of Vayu is more important, like we say nerve endings. Deepest part, Vayu movement is more important. If Vada is provoked there, you get major movements getting impact, like Ekshma Pakshavada Ardhita, major diseases. Where the Vayu movement is prominent, then only you call it as a Vata. So our work is to induce sufficient Snigdha and Ushna conduct. Padasyoktama Snehasveda, Samshodhanam. Snigdha and Ushna we need to induce. Medicine will not do it. Calculating all other factors like Ushin and all, you need to induce the grade needed for that particular individual. So, where do you induce it? Internally, you can give medicines which are Snigdha and Ushma, like Rasna, varieties of that. Externally, how do you induce? You induce it to the entire skin, because that is the most porous part in the body. If it is porous, the first thing to enter that pores will be the Vayu. That's why we say Tok is Vadasthanam. So if it is a major disease, whether it's L4, L5 or a cervical, whole body abdomen will be yielding the result. It makes the body Snigdha internally. Next option is Pakvasya, where the sufficient amount of Ruksha nature is transferred to checkmate the Snigdha coming from Amasya. To limit it, sufficient amount of Ruksha is transferred from the Pakvasya. So wherever Vatavyadi is expected, basically the Pakvasyam also will be contributing excess of Ruksha. So to pacify that, you induce Vasti as a treatment of choice in Vatavyadi. If you have a clarity of what is the body according to our Shastra, I think Vasti will be the preferred treatment. Then as a complementary treatment, Kadi Vasti or Jani Vasti or Giva Vasti, whatever you are doing. So it's a retention of oil in that affected area to make it soft. But to see that the structures of bone, muscles or ligaments are gradually supplied with sufficient Snigdha content, you need to do it through Pakvasya. So this is the full advantage of understanding what is the body according to our Shastra. Shastra always give 100% a perfect mode of management, which may not be possible by human. A perfect mode of health also, that may not be so easy. But an overall understanding of that, you can use it then and there in assessing a situation, accordingly selecting a medicine or treatment schedule in every day's practice. That's all.
Sir, thank you, sir, for that elaborate description, and that has enlightened us. Now we request Pervaje sir to share his experiences and share his understanding and his practical experiences regarding some of the understanding of Rogamargas, which has helped in his practice. Thank you.
So thank you. That was, I think, very good explanation given by Jayakrishnan sir. Now I will explain about, discuss about 2-3 diseases. How this Rogamarga is useful. Rogamarga is, 3 Rogamargas. So, for example, in the Pakshaghata, where it is very useful in diagnosing and about Vyadhi and its Avastha. Both you can diagnose by utilizing this Rogamarga. So what happens in Rogamarga Pakshaghata? He says Tiryagadamani Urdhva Dehaga is involved. When the Prakupitavata gets Sambhasha Tiryagadamani Urdhva Dehaga, Anyatara Sandhi Bandhakar, whole body one side is become weak. That means Marma is involved, Madhyama Rogamarga. And at the same time, Anyatara Paksha Sandhi Vibandhakas, not only Sandhi, Mamsa, Snayu, everything is involved. Now, what happens when acute stroke, acute state, when they come, you see, what they come with, just weakness, one side slight weakness, and slightly they were in the state of Mada state, Mada, or they will go to Murcha, or they may go to Sannyasa state, and then there will be one-sided weakness. Initially, when they come walking vertically to our hospital. They are not in horizontal position, they are in vertical, they come walking. And as evaluation occurs, 2-3 days, then they will lose their consciousness, one-sided weakness complete occurs. And there will be, at that state, in some patients, if doshas are more, at again and again, this Vayu gets the graha of that area, there will be akshepaka. Repeated akshepaka may be there. Akshepaka may be, there will not be continuous akshepaka, there will be slight movement of eyeballs, all these things. We tell it is a apatanaka. So this is stage initially patient is with the very rigid muscles with the akshepaka. A pakshagata in akshepaka avastha will be there. So involvement is marma, shiro marma involvement is there. Tiryagadam Urdu deva. And after 2-3 days, slowly, when it comes down, evaluation occurs slowly. Even if you don't treat, if doshas are very less, so what happens? Slowly, he will. That's rigidity goes. Then there will be flaccid muscles and whole side complete weakness. He becomes a complete horizontal. If patient is lucky, he will survive. Other with the modern medicines, amastambana, he will survive. Otherwise, he may die. This is what happens. So in Ayurveda, it's very important for us to for the purpose of treatment. Why I am saying, when they are in akshepaka avastha, then the treatment will be akshepaka chikitsa, not pakshagata chikitsa. At that time, abhyanga sweda is not useful. At that time, akshepaka chikitsa should be done. That akshepaka chikitsa, he says, shira shuddhyartam tikshna shiro virechana nasya. That is for shiro marma. It's a Urdu, the area of pathology is there. Anyhow, the mula of the vata may be pakvashaya from koshta. It may go to there, and there will be this one sthana samshaya at Tiryagadamani. You will have pakshagata. That area is that area in marmasthana. When you treatment is shiro marma tikshna nasya, you do, patient awakens from mada or mucha, he awakens. Then you give Prabhuta matra acha sarpipana. Then he says, Nati matra vayu prasarayati. Vayu prasarana to shakas are prevented. That means, once dosha gets sansamshya, then its anuvisarpa will be there whole body. Not only in abhyantara rogamarga or madhyama rogamarga, even to bahya rogamarga, all over body, there will be prasarana of the doshas. So to prevent that, he says, give Prabhuta matra snehapana. So that what happens? This prasarana of vayu is prevented. See, akshepaka is stopped, and that rigid muscles are become cleared. Then you go for pakshagata chikitsa afterwards. It is a avastha of the vyadhi. Same dosha, samshaya, it has different avasthas according to samshaya. Initially tidyagadhamani. Then there will be prasarana of the dosha all over body. So all over there is sandhi vibandha occurs. It's all according to stage. This understanding very important of Rogamargas. So according to after that, when pakshagata chikitsa, you are doing abhyanga sweda 6 bahya Rogamarga. You are doing the abhyanga and sweda. And for abhyantara Rogamarga, you are giving basti because mula sthana of vata is there. For that you are doing basti karma. That is the final treatment. Like that, 3-4 months we are doing, and shirodhara, all these things, because it is shiro marma is involved. This is one disease explanation how rogamarga, different rogamargas involved for in a single disease. Like that, in grudrasi, you see grudrasi, what happens? Just you see grudrasi or vishwachi, there will be a injury, that is abhigata to the grudrasi snayu. There will raktarnavata and whole snayu and is involved. Initially snayu is involved, that's a madhyama rogamarga. But slowly, if you don't treat him, the whole muscles are degenerated. That is bahya rogamarga. So from one rogamarga to another rogamarga, pathogenesis, dosha goes, and patient is going to rukshata, everything will occur. So we have to treat the mula sthana at the same time. That shakha also, everything should be treated accordingly. So that is why the treatment should be karya karana chikitsa. That's anuktamapi doshanam lingaihi vyadhyam vacheres. That is dosha vyadhi viparita chikitsa. Dosha chikitsa and vyadhi chikitsa. Vyadhi chikitsa should be selected. The protocol is selected according to sthana samshaya, but its drugs are selected according to dosha. And doshas have its own mahabhuta components, and these mahabhutas, according to that, there will be its gunas. By this taratama bhava of different gunas are expressed in our body by different lakshanas, vyadhi lakshanas, vyadhi lingas. By this, analyzing this vyadhi linga, you find out which guna of which dosha is involved. Like that, we have to select a particular treat medicines. But protocol is according to Vyadhi, according to Samshaya. For example, for Grudrasi, he says, Chirabasti Agnikarmascha. For Pakshagata, he says, when Akshayapaka is there, you do Nasya, Snehapana, all these things. When it is in Pakshagata, Sneham Svayamyuktam Pakshagata Virechanam. So, according to Vyadhi, there will be different protocol. But that drugs, according to which doshas involved. For example, there may be a avarana state, there may be dhatuksha state. Again, that avastha will be, patient may, that is why in Vata Vyadhyadhyas he says, Hetu Sthana Vishesha Bhaved Roga Vishesha. According to Hetu Vishesha, according to Sthana Vishesha, there will be Roga Vishesha. Vishesha means Vibhakti. You are doing a differential diagnosis. You are doing different way. By doshas also you are doing differential diagnosis. According to Sthana also you are doing the differential diagnosis. By Sthana Vishesha you understand different Vyadhis. According to Dosha Vishesha, we are understand different science and systems that Vyadhi. So both way we have to diagnose. Both you should understand. Then a specific treatment protocol and its drugs are selected. So for that he says, Vayoho Dhatukshayat Kopo Margasya Avaranena. Vata Prakopa may be by from Kosta Dhatukshayakars Vata Prakopakars, or in the Shakas there will be Anyonya Avaranat. Avaranat Vata Prakopakars. Then Prakopas, Prakubita Vata gets Samshaya. By Vimargavana you get a different Vyadhis like Gridrasi or Pakshagata. So like that. In which way a Vyadhi occurs, you have to find out. So diagnosis means Samprapti means not just the name of the disease. Diagnosis means understanding this pathogenesis from start to end. Yatha Dushtena Doshena. That is why he says Hetu Vishesha means, he says Hetu Vishesha means Pitta Avaranadi. Yatha Dosha Prakopa. Is it by Pitta Avarana? Is it by Kapha Avarana? Is it Rakta Avarana? Is it Mamsa Avarana? Yatha Dushtena Doshena. Sthana Samshaya Koshta Yatra Sthana Samshaya. So both we have to understand. This Sthana Samshaya, different Rogamargas. That is why this Rogamarga is very important to understand. And Hetu Vishesha, I think already for last 3-4 days they have discussed. Now today we are discussing about Yatra Sthana Samshaya, different places. This Sthana Samshaya is very important. For example, in Kushta, we are treating only skin. It is not important. It is from skin, you see, Tvakka, Rakta, Lasika and Mamsa. Primarily it is involved Rakta Dhatu, but Rakta Dhatu's Mula is Yakrit and Pliha, that is Koshtasthana. So we are treating only Rakta Dhatu in Tvakroga by applying, it is not sufficient. We have to treat the Koshta also. That is why Vamana Virechan is explained in Kushta. So I think this understanding of Rogamarga, if you don't understand this Rogamarga, this Mula Sthana of Rakta is this one. Yakrit and Pliha. So Koshta Shuddhi we should give. Like that for Tvak is Upadatu of Rasa. For example, it's a very interesting understanding. You see, some patient comes with Pranava Srotas Vyadhi, they like Shwasa Kasa, etc. So same person may sometime come with just skin eruptions, all these things. So because Rasa Dhatu and Pranava Srota Mula is Hridaya. That is Rasa Srotas Mula. So it may express as at a Pranava Srotas or it may express in the Tvak. Anywhere it can express. So when just by seeing its expression area, giving treatment, that Sthana is not important. It's Mula, up to Mula, whole. So up to Koshta also, everything is involved from Shakha to Koshta and in Madhyama Rogamarga and Marma, wherever it is there. So whole thing, if you understand this Rogamargas, I think specific treatment modalities we can evaluate in each patient. Even a patient comes with the modern diagnosis, we understand according to Ayurveda what it is. It's very important. For example, usually, I think other day there was a discussion of why this modern diagnosis materials we should use. But by this, I think we can understand. I think I can talk another 5 minutes about this one, because it is very important to understanding this Rogamargas, and it's because why I am saying, usually in all the Vaidyas, allopathy or Ayurveda, we have a BP apparatus. Why BP apparatus for that? what we can understand by this using BP apparatus. So we should understand how and why this BP apparatus we should use. What is BP? Is blood pressure. Blood pressure means what? We should understand what we are doing. We are measuring pressure of the blood. Blood where? Blood means what is blood? Blood means usually we translate it into as rakta, but actually you are measuring a moving pressure in a artery. What is the artery? We should see from heart, Hridaya, whatever blood goes through the arterial capillaries, this artery's pressure we are measuring. What is this arterial blood what we are having? That we should understand. So you see, from Hridaya by Dasha Dhamani, Shakanu Shakavat, it is spreading continuously to all our body. It nourishes all the tissues in the body. So nourishment is done by Prenana, is done by which dhatu? It is not Rakta, it is Rasa dhatu. So Rasa dhatu is moving from Hridaya and Dashanamani. Aharaha gacchati by Vyanavayu. Vyanavayu is moving force. So actually we are measuring moving force of Vyanavayu, how much it is there by this blood pressure instrument. So if we understand this one, this becomes very easy. So what it is, how it goes? It goes Prakashavat and Shakhanushakavat and Shabdavat. These things, then definitely it is a arterial blood, which is nothing but a rasadhatu. According to Ayurveda, it does the preenan of all the tissues in the body. We are measuring that Vyanavayu force, how much it is. So to understand this more, we can understand like this. By this Dravya Guna Karma, you understood. By understanding by Samanya Vishesh Siddhanta, we can substantiate it. For example, a person is moving all over city without drinking a water. In the evening, he falls down. When I check his BP, it becomes 80/60. So that is hypotension. But according to Ayurveda, usually we think it is Vyanavayu decrease. Not Vyanavayu is not decreased. A decreased dosha cannot produce a Vyadhi, like Brahma and Mada or Murcha. Become unconscious, you see. Actually, what happens there? Vata Prakopa can be Dhatu Kshaya also. There is Dhatu Kshayat Vata Prakopa. When BP down means, that is Rasa Dhatu Kshayat Vata Prakopa gets Samshaya to 3 marmas. 3 marmas are Hridaya, Basti and Shirasu. Wherever Samshaya occurs, Dhatu Kshayat Vata Prakopa. Immediately you give salt water to drink. Or if he could not drink, you put a IV line, dexamet, normal saline you are putting inside into the vein, and so volume rasadhatu brahmana occurs, then naturally he gets a normal blood pressure. Then you come, what is hypertension? That question occurs. Whenever there is a avaranat, that is peripheral resistance increased. By ahara vihara, continuously you are doing all these things. When artery becomes tightened by this avarana, Vata Prakopa occurs. That is, then there will be blood pressure usually increased. A Avaranat Vata Prakopa will be blood pressure increase. Avarana may be Kapha or Pitta. Anything can happen. A Kapha Avaranat blood pressure increase, such persons you can see, he will have heaviness and edema, Shotha all over body. And some person who is having Brahma and Trishna or Murcha, these symptoms will be always by Pitta Avarana. Anything can happen that you should diagnose according to Ayurveda. So this modern investigating apparatus, we should understand according to Ayurveda how it works. By this, what happens? Whole Shaka all over body, Shaka, Koshta and Marma, everywhere it produces, we can diagnose by utilizing blood pressure instrument. All 3 marmas can be utilized. When Basti marma is nothing but according to renal function what we are doing today, it is like Basti marma's work. There may be a renal failure. Usually there may blood pressure is increased. Or Hridaya marma may be attacked. You will have a heart attack, or these things can be understood. And Shiro marma, Brahma, all these things, everything, a patient may go for a stroke, everything you can understand by utilizing a investigative agent like a blood pressure instrument. But we are not giving a blood pressure, translate into Rakta Chapa and give Sarpagandha. It is not Ayurveda. It is actually allopathic principle. You are giving some herbal drug. According to Ayurveda, you do Brahmana, Rasa Brahmana or Avarana Hara. That is Vamana, Virechana or Anulomana Dravya. You give continuously. Naturally, his blood pressure comes down if possible. If it is Parisamvatsara, after 1 year, all Avarana Vyadhis becomes Yapya. That will be there with you all our life. With this understanding of different diseases, I think I have explained why Rogamarga understanding. These things are dosha and Rogamarga, dosha. Everything is important. That is why Vagbhata says, Dushyam desham balam kalalam analam vayah sattam satyam aharam avastasya sukshme sukshma pariksha. First dosha nirupane. Do the dosha nirupana. Then you do aushada nirupana. So dosha nirupana, accordingly, aushada nirupana. In dosha nirupana again, which mahabhuta and which guna of that dosha is involved, like that you select a aushada nirupana. I think I have answered your question, sir.
Yes, sir. Definitely, sir. It has been a very thought-provoking discussion, and you have given us elaborate concept of Rogamarga in the various very common medical situations. What approach have to be or what strategies have to be developed on the basis of the premise of fundamental understanding. So thank you for that excellent. Now, I think we are almost around time, and now it's a time for the members of the assembly to come up with your point, your point of discussion, or maybe raise your doubts, so that these eminent scholars can answer some of them, or maybe satisfy some of our queries. So it's time for discussion now. And I invite the members of the assembly to come up with some questions. See, already there has been some discussions occurring on the chat box, and one of the questions is Rasa Dushti or Vada Vriddhi should be targeted in hypertension treatment? This is one of the questions, sir. Is Rasa Dushti or Vada Vriddhi should be targeted in hypertension? And sir, I request Pervaje sir to please address this question.
That is good. Actually, hello. Yes, am I talk?
Yes, sir. Yes, sir. Yes, you can go ahead, sir.
What happens when there is a Rasa Dhatu Kshaya, there will be hypotension. For Dhatu Kshaya, you are giving Rasa Brahmana. That is what usually we give Madhipala Rasayana in our hospital, or tender coconut with the salt to drink. So naturally, I think many patients comes with hypotension in our clinical practice. That is low blood pressure. Many patients, they come with the Brahma, all these things. Usually, I give Madhipala Rasayana for such patients. It contains Lavana and Amla Dravya. And I give Ashwagandha Kshirapaka. By this, what happens? Naturally, and Ashwagandha Churna with the Rasa Sindhura or with the Makaradhvaja and Pravala Bhasma. By this, what happens? His Rasa Dhatu Kshaya naturally slowly it increases. His blood pressure becomes normalized. He becomes his Brahma comes down. For hypertension, this is for hypertension. For hypertension, there is a Avarana Vata Prakopa. That Avarana should be treated. If it is, that may be usually Pitta or Kapha Avarana according to his signs and symptoms. Is it Brahma Murcha is there? That is, you have to give Pitta Hara Vata Anulomana Chikitsa. Or Virechana you can give. Kapha Hara Vata Anulomana, if it is Kapha Avarana is there, you give Vamana and then you go for Vata, Vamana, Virechana and Vata Anulomana Chikitsa. If patient comes within a year, it may helpful. After 1 year of the hypertension, naturally Avarana Janya Vyadhi, after Parisamvatsara it becomes a Yapya. So I think our drugs are very limited, you can try Vata Anulomana Chikitsa continuously. So I think I have answered that question. Hello? Hello?
Yes, sir, you have answered. I think he's having some problem. I think you answered, and we would like to have a opinion from Jayakrishnan sir too. The same thing.
Yeah. Yes.
Jayakrishnan sir. Jayakrishnan sir, please unmute, sir. You are mute, sir. Jayakrishnan sir.
Unmute.
Sir, one second, sir. 1 second, sir. Sir, once more, sir. Once more.
Yeah.
Okay, sir. And please hold the mic close to your mouth, sir, because your sound is very feeble.
Yeah, fine. Is it okay?
Yeah, now okay, sir. Now okay, sir.
Yeah. Fine. It's about hypertension, I think. Isn't it? Hello? Hello?
Yes, sir. Continue, sir. We can hear. It's audible.
Yeah. It is about the hypertension. The question was raised, overall picture, I can mention about that. Hypertension, we all know the risk is about Vata Vyadhi, or it may be a risk to the heart or liver or kidney, even lungs. Only 5 hypertensions are mentioned, So it's all damage or weakness to the structure you are expecting a disease out of that, like a stroke. So just before the stroke, what is happening is just the Vata Vruddha state, increased Vata condition. So we must try to find out, as I told earlier in this Vata Vyadhi, we must try to find out what is the background for increased Vata state, whether it is related to the Kosta or it is related to your excessive activities, which can weaken the Dhadus, or any other background disease which are not usually considered. That also can create an extra activity in your body and weakness subsequently. So we just try to find out why the Vata is provoked from different sources. It's related to food, your activity, or any other background disease, and excess use of your systems. Like if your brain, you are using beyond your requirement. The brain activities, mental activities, nothing but chinta. Chinta can create extra activity in the brain. We call it a mental activity along with pranavayu. Just like Pervaje was telling, he's an expert, I think, in dealing with acute states of stroke. That's what I heard. So the brain activity can be excess if somebody who is having the nature of thinking too much, or as a restless mind, you worry about too much, where you can have too much of thoughts, where you are provoking pranavayu with excess of activity in the mind, chinta, which is a Vada Nidana. So we just try to find out what is provoking the Vata in the body before it manifests into a Vata Vyadhi. In that, if you understand, this I have demonstrated also just by giving Abhyaristam in front of the students for a bystander of a patient. The BP was brought down many years back. Abhyaristam for 10 days continuously, twice. His BP was coming down gradually. Just for a curiosity, I ask the students to watch it every day. It has been done. For some people, just a talam on the head. If the head is the main culprit in reducing this, provoking the Vata, the talam with the Shirabala, Avarti, with Kachura, the Churnam and all, can reduce it. If it is related to the lungs and all, you need to treat that condition like chronic Kasa, Shwasa, especially in this present condition of COVID. The weakness is precipitated easily in the respiratory system, where you need to tone up. You use Rasayana Dravyas like Agastya Rasayan and all for a little longer time, where it can nourish the structures of the respiratory system, where the Ruksha nature is slowly reduced. That is the reason it can come down. So our concern is, it is a Vata condition. We know Vata Vruddha condition, which can lead to Vata Vyadhi. Your duty is to see Yadha Dushtena Doshena, why it has increase in this particular person. Different people, it can be different reasons. So this is what we are looking for. And to that, we will be reacting, we'll be responding with medicines. Book serves as a guidance, whether it is a Shamana Chikitsa or Shodhana Chikitsa, as Sir was mentioning. There you see, Akshebhaga is there, Nasyam was mentioned, Virejanam is mentioned for Pakshagata. Then book serves as an example, where you have a background knowledge, a clarity in our own way of assessing things. Any other knowledge will be complementary. You take Western knowledge, you go for what you say, chiropractic, osteopathy, Chinese, any kind of knowledge regarding the health of the body, it will be complementary if you have very good clarity in our own science. If you lack clarity in our own science, other knowledges may be sometimes a headache. It can mislead also sometimes. Okay. I think it's clear on that question.
Thank you, sir. Thank you, sir. I think there is a hand raise from Dr. Ramya.
Prakash,
Yes,
is that
yes,
clear?
yes, sir. It is very clear. Professor, can you take a hit this clearing session?
We have one hand raise from Dr. Ramya. Dr. Ramya, please unmute yourself and come up with your question.
Good evening, sir. Am I audible, sir?
Yes, very much.
Respected Jayakrishnan sir, respected Pervaje sir. I would like to know your opinion on an area that I've already asked in the chat box, that all diseases, since Agni, our Mahasrotas is the sthana for Agni, can we say all diseases, anyway, all diseases, Nija dosha, Nija rogas will be having Agni Doshti. So can we say all diseases will have its beginning in Antasrotas or Abhyantara Srotas, and then moving on to Shaka or Madhyama Rogamarga for manifestation? And if it is yes, in this shloka it is very specifically told Anta Koshto Mahasrota Amapakvashya Atisara Kasa Shwasa Udara Shofa Arsha are the specific diseases that has been mentioned over there. So is it that those diseases will be having more relevance not in other diseases, or how? What is your experience and viewpoint on that? Thank you, sir.
I think some of the panelists can start answering the query. Maybe Jayakrishnan sir can start with it, and Ravishankar sir can continue.
I think if you can repeat that content of that question, I was not very clear on that.
Ramya, can you just repeat the gist of the question?
Yes, sir. Yes, sir. Yes, sir. Sir, Agni is in the Mahasrotas. So Mahasrotas is one of the Rogamargam. So all Nija diseases will be starting with the affliction of Agni. So can we say for all Nija Rogas, Mahasrotas will be the Rogamarga, Mahasrotas or Abhyantara Rogamarga will be the starting area, and only from Abhyantara Rogamarga it will be going to manifest in the Madhyama Rogamarga or Shaka, the Bahya Rogamarga. And if it is so, we could see the specific mentioning of Shofa, Arsha, Gulma, Chardi, Atisara, Kasa, Shwasa, etc. in the area that has been mentioning Abhyantara Rogamarga of Ashtanga Hridayam. So what is the relevance of those diseases? Sir, hope I'm clear, sir.
Okay, in Abhyantara Rogamarga. Fine. Yeah. Relevance of Kasa Shwasa. If Agni alone is the basic thing related to the Koshta, isn't it? Yeah. No, technically speaking, that's why I told in the beginning itself, Kayo Agni Tasya Jigissa Kaya Jigissa. Agni is actually in the middle of Panjabhutas. One side, it is just destroying the Kaba related Jala. Other side, it is supported by Vayu to have a normal inflamed status. So it is the balance of Agni which is maintaining Kaba on one side, Vayu on other side. So even though it is partially opposite to both. So Agni is the basic thing with which you are destroying the food to be assimilated into every nook and corner of the body. And this is what you say normalcy of the structures. That's why in Swastha we say Samadosha Samagnischa. Doshas are responsible for all functions of the body, which is well connected to Agni. And Agni Chikitsa is basically, you see in all Chikitsas, Agni Chikitsa will be there. In Malayalam, we say without Shundi, there is no Kashayam, no? Without Chukka, there is no Kashayam. That is meant for Devanam. If Agni is set right, doshas can be easily managed in the Koshta, and that will be reflected in Dhadus and Madhyama Rogamargas. That's a normal way of understanding things. That's why the importance of Agni. And even Agni is responsible for maintaining the balance of Shida Guna in the whole body. Proper Agni or proper Ushna is maintained. It is actually a check to see that the Shida nature of Vayu as well as Kapha is maintained. It has a bigger role to play. It's not just digestion alone. In all medicines, what we are giving for different diseases, something will be targeted Agni. It need not be always Shundi. You can understand the Guluchadi Kashayam, where nothing Ushna is needed, but its indication is Agni Krit. All Shita Drivyas are there, still its indication is Agni Krit. Reason is that Agni can be sometimes rendered functionless due to Kapha, due to Pitta, due to Vata. For example, Kapha, suppose you are having excess of food which reduces the Agni, something to digest that. Excess of Pitta also can have a dysfunction, create dysfunction, where you are addressing Pitta. Pitta is reduced, Agni is given freedom to work. If stomach becomes weak, you say Vata. Still Agni cannot function there. Reason is because of this Vata nature of the stomach, where you are supposed to induce Nigdha. Stomach gets little strengthened, the Agni will be able to function. This is very clear when we explain the Jwara Chikitsa. Then Kasa, Shwasa and all basically related to, we know Vada functions, which are Prano, Hyuda, Anugata, Pradishta, Kasa. And Samana Vayus involved, you call it as Shwasa. It's, that and all is related not to the intestine alone, right from mouth, alimentary tract, where the passage of Udana Vayu also you can start with. And then Samana Vayu is also having similar functions. And these things are involved. You remember Jwara is included actually in Dhatu, Rasa Dhatu. So Vata functions of Kasa, Shwasa and all are basically dysfunction to Vata related to these areas, Kabasthana. So Vata are well connected to this movement of Koshta, visibly Koshta. You include it in the Koshta related areas. There you are addressing also. In Shwasa Chikitsa, it is very, very clearly told you need to address Vata with Santarpanam. At the same time, you need to address Kapha with Apatarpanam. An increase of Vata may be fatal. When you do Apatarpanam, Vata may increase. It may be fatal. So ensure that Vata is protected at all the cost. End of Shwasa Chikitsa, this is how it is explained. So Vata is involved in Shwasa Kasa and all. It is well connected to this Koshta movement. Through that, it is entering into the body. So we need to be careful with that. It can disturb any other component of Vata, like Pranavayu. It can be dangerous then. Apanavayu, it can go to any other plane that is getting disturbed. So in a serious condition, all five Vadus can be disturbed, which can be starting from this area of Udanavayu or even Samana. So that's why Kasa, Shwasa and all come under that category.
Okay, sir. I think Pervaje sir may be having something to add to Jayakrishnan sir's comment regarding Dr. Ramya's question.
Yes, I will answer. You see, as sir already told, Kaya iti Agni tasya chikitsa, Kaya chikitsa. So Agni, how you think it is occur? It is only, its Moolasthana is Jatara, but it presents all over body. So whenever, that is why in Ama production he has to Sarve Roga Mandagno, Sutaram Udarani, all the Rogas by Mandagni only. So in that is why in production of Ama he said Ushman always Atumadnya Pachan, one is in Posta only. But another shloka for Ama is Anyonya Murchana, at Shakhas, there may be Anyonya Murchana of doshas. When Anyonya Murchana of dosha is there, then there will be Agnimandya, immediately there will be production of Ama. So that produces the disease. It will occur in Shakhas. It's not related with the in your koshta only. Wherever Anyonya Murcha, anyhow, basically there may be koshta involved for production of that increased some dhatus like kapha or pitta by Agnimandya. But naturally, in the Shakha, there will be Anyonya Avarana occurs, then the specific area there will be Agnimandya and the production of the Ama and different dosha Swarupa Ama, you produce different specific Vyadhis at a particular Shakha anywhere. That is why you don't think on Agnimandya it gives only Atisara, Shopa, Gulma or Kasashwasa. Other Shakhas Vyadhi or Marma Vyadhis like Sandhyastigata, Vata, all these things, that also produces due to Ama only. Ama, for production Ama, there should be Agnimandya. Agnimandya, when there is Anyonya Murchanas also, Agnimandya can occur, you get Avarana and Vata Prakopa. Prakritava gets Samsha, you get different Vyadhis. Not only for Vata Vyadhi, for other Vyadhis also. Different in Shakas or Marma, Sandhyasti, anywhere it can occur in a specific area. So I think I have added the question, answered your question. Thank you.
I would like to add a point to Dr. Ramya's question. If I think it is okay. Because I think the question, if I understood it properly, was that see, all the doshas have their basic seat in the koshta, and in the Nijarogas, they travel from the koshta, it is presumed. So why do we have different diseases listed under the other Rogamargas? That is, I think, that is also a question, I think. So I would like to comment on it in different way, that the prasarana of doshas is from the koshta, no doubt. But the rogas and the dosha kopa are different. The prasara again goes through the different rogamargas and get their sthana samshraya in those different rogamargas. Sometimes they get the sthana samshraya in the koshta, different areas of the koshta rogamarga. Sometimes they go out called Tiryagamana, and sometimes into the shakha or into the madhyama rogamarga. And according to the sthana samshraya, the different vyadhis are named. So the dosha kopa and vyadhi, these things are little bit different on the basis of the sthana samshraya what they get. So the diseases explained in different rogamargas are based on the sthana samshraya and that vyadhi nama, whereas what Dr. Ramya asked could be, I think if I understood it right again, maybe about the dosha, not about the vyadhi. Anyway, I think we will go further. There are a lot of comments in the chat box, but there are no specific questions now. So I think we may conclude our session. Unfortunately, our discussant is out of the room because of the poor connectivity. So I would like the panelists, one after the other, to give one concluding note, something like a take-home message about the understanding of Rogamargas, or overall. I think even though we were discussing about Rogamargas, we had a very elaborate discussion about the Samprapti, then the different types of approaches that we have to adopt as clinicians. So Jayakrishnan sir, please give your concluding note, something like a take-home message. Please unmute yourself and talk, sir. Please unmute your line.
Okay. So thank you. I think these last 7 sessions are about the Nidana. So what I would like to convey is Nidana is a knowledge. Rather, Nidanam, Purvarupam, Rupam, Upashayam, put together, Samprapti is a knowledge you create with the wisdom. You connect, you coordinate, Nidanam, Purvarupam, Rupam, Upashyam, to create a knowledge of what has happened now in the body of this particular individual. And this knowledge is well connected to the, if you draw it back, it is well connected to the understanding the body based on three doshas, naturally well connected to Rogamargas. If three doshas are to be understood convincingly, you need a little philosophical touch to understand Panchabhuta and probably little philosophies. You don't require a lot of philosophy, but a little philosophy you need to say that like Shaddhadu Purusha, individual with Panchabhuta is the person. So that understanding should be there to have Panchabhuta understanding. From there you understand Tridosha. From there you understand how it is placed in the normalcy. Then you understand how it is going to affect it in the diseases. So this understanding is directly proportionate to what you are going to do. You can even go wrong in making the assessment. There's no problem. If you understand that you have gone wrong, that is a great knowledge. As Einstein says, when you understand that I am not understood, that's a big knowledge. But you must have a understanding of what has happened in the body. And this knowledge of Samprapti is directly proportionate to what you are going to do as in the management of disease. So ensure that each individual, each doctor, majority of the people are interested in practice, or rather Ayurveda is meant for practicing. It is a Shastra, it is not a, it is a Tantra, it is not a mantra. Tantra is something to be practiced. So Ayurvedic people, whoever is studying, majority of them want to do practice, cure diseases, and lend a helping hand to the people who are suffering from diseases. So to that, we must have a clarity of knowledge. So Nidanam or Samprapti is a knowledge that you create based on all these informations, which is directly proportionate to what you are going to do. Anything you can do need not be just fixed with the medicines and all. Your mind should be free with that, based on what you understand, going deeply, little deeply into the understandings of what is going wrong, based on Tridosha. Whatever extra knowledge you get, let it be complementary to this understanding, convert it to our own understanding, so that you get a wider areas open, wider options for dealing with each individual. So let the brain feel free, mind be kept open, so that you also feel 100% satisfied. That is my message. Thank you.
Pervaje sir.
Thank you very much. So to conclude, today's session is for Rogamarga. Even though Rogamarga, but doshas are getting get Sambhasha at different places in the body. So without dosha, I think hetu, only sthana, we can't discuss. It's all interconnected, just like father and mother for production of a new entity like a disease. So by so a student should understand both dosha, that is karana, and karya, that is sthana. By that, there will be different signs and symptoms. So what happens? No patient will come to you and tell, I have this linga because of this karana, because of this dosha, that is why you give the treatment. Patient comes, hetu linga vishwadam jnanam sastadra parayanam. Patient comes with the linga. He tells, these are my symptoms. By analyzing these signs and symptoms, you should understand what is sthana samshaya. You have to find out what is hetu, and give hetu, sthana vishesha hetu, vyadhi viparita, chikitsa. So that is why you should understand both dosha and vyadhi. By that you should understand how dosha prakopa has occurred and where this sthana samshaya occurred in different rogamargas, and understand it properly and give the treatment. It is just like a mathematics, just a mathematics. Just which dosha is involved, increased, you do deduct it. If it is decreased, you should add it. It is just a you are all mathematicians, not magicians, you are mathematicians. Actually, Ayurveda is purely mathematical science. If you have a beautiful understanding of this mathematics, I think properly you can treat any patient with the analysis of this tattva of Ayurveda. So that is why Sushruta says, Sarvam Sarvada Alochya, you Tattvena Karyam. After that, Karyakarana Vivechana, you do the Karya. So with this, I am very thankful for giving this opportunity to share my experience to you. Thank you very much.
So I think with this we conclude this session. We had definitely a very, very beautiful, very wonderful and very deep discussion. I would better say a conversation about the very conflicting sometimes, which needs a lot of contemplation sometimes, that sort of specific topics. And interestingly, this is the 7th day of our Vagbhata Sameeksha. On the day 1, we had that Anusmarana Prabhashanam, and the remaining 6 days we had this Tadvidya Sambhasha, conversations on Sarvaroga Nidanam. And we are really happy that we are concluding this 7-day program with a wonderful conversation between two legends, Ravishankar Pervaje sir and Jayakrishnan sir. Now I hand over the dais to the host to get some feedbacks. I think there were so many delegates who were regular participants in the 7-day program. So I request the host to take over and call upon the delegates, those who are interested, for a feedback, please.
Sure, sir. First of all, thank you for the outstanding, excellent session, traveling through the unseen corridors of theoretical aspects and the practical demonstration, the enough practical demonstration. Thank you, Jayakrishnan sir, Ravishankar Pervaje sir, Sethuraj sir, and Prasad sir for taking it over. Now, before going to the conclusion session, we would like to, Tirunelpad Foundation would like to hear from the delegates, your feedback, your suggestion. We appreciate it so much. Please unmute yourself and give us your feedback, please. Anybody, please.
Hello.
Yeah, ma'am.
Hello. Okay. I think I really need to express all my gratitude to the whole team, because for the last 7 days I had tried to attend most of them and I missed anyway. But 2 or 3 things I would specifically would like to know is, after listening to these things, students who are a part of, students at Ashtangam, I am a teacher at Ashtangam. So our students who had listened to these discussions, actually we were perplexed with so many questions from them. So madam, after the discussions on Purarupa Rupa and the discussions on Samprapti and the discussion on the first day, so many of our students have communicated to us, and Dr. Rahul, who teaches them Nidanam, they have like, madam, the way we have learned and all, it is not okay. We need to study more. What should we do? Is this the way we are going correct? What should we do? The Nidanam that I assess is not correct, I feel. So these types of thought processes have come from our students after listening to these things. I think all who have attended these sessions, everyone could have or get inspired in their own way. Students were provoked with thoughts. Being a little senior person, I had been getting more and more clarity on some of the things which we were undergoing, of course with more and more questions also on some of the things. And I at this particular point understand that it's a journey. Like from a student, from you move on and you reach a point probably wherein you'll be getting more and more clarity. But for all those things, such Tadvidya Sambhasha with knowledgeable person would definitely enhance our understanding, specifically with respect to Ayurvedic concepts. wherein we really need understanding because it comes from a fundamental understanding with a different background. You could see many the discussants and the what you call it as the speakers or the guest speakers were all of that stature, and we could also get exposed to people who were never, as in Kerala we were never exposed to that scholars from other parts of India too. So that was all a very enriching experience. So and today actually when I was reading the Ayurveda Darshanam written by Tirumulpad sir, such an in-depth work. To be very frank enough, being a teacher, I had never read it totally because it was so. Whenever I started reading the text, I mean the content written by Tirumulpad sir, I used to feel it's very heavy for me to understand. But you know, all these things, all these days when I was listening to all these things, the basic thing that went into my side was I should read all the literature that has already been written by Tirumulpad sir, which would definitely bring clarity to us more and more. I request, it is my experience that all who are listening, of course, who know Malayalam, and I pray that all Tirumulpad sir's literature must get translated to English, because people who are not understanding Malayalam, they also should be giving an opportunity to get understood to those in-depth thoughts that gives us more clarity about our Shastra. So I was more brought near Tirumulpad sir, and I think for that, what you call it as, I thank the whole team, and I pray that foundation continue to do such sessions, because such things will definitely bring a better output of Shastra in total. There is no doubt about it, and I'm convinced. So thank you for the whole team, Prasad sir, Om Prakash, and the whole team who have organized such a wonderful session. And I pray every year such things happen. Thank you.
Hello.
Somebody else can.
Hello.
Yes, Dr. Supratim.
Sir, sir, good evening. My pranam to Prasad sir and Pervaje sir and to the all respected physicians today present in the forum. Sir, it was a huge opportunity to learn. And I do really think that in this era, in this present situation, Kerala South School of Ayurveda, the Kerala can lead the Ayurveda practitioners of the India in the right way, sir. And it was a blessing of such, I would say the Corona blessed us this webinar kind of thing. For why? I am personally able to attend this kind of workshop, which was previously to be organized by the schools of Ayurveda in Kerala, and which was really tough to attend. But it was a blessing of Corona that we people are fortunate to listen to the scholars from the South School of Ayurveda, and it was really huge opportunity to apply the modern Ayurveda in real way. Sir, my heartful gratitude to Tirumulapad Foundation, and I hope that I would be the part of in future ventures of this journey of Ayurveda knowledge, sir. My heartful pranam to you all, sir, to the organizers. Thank you, sir.
Thank you, Supratim. And there is an international delegate also. We would like to hear from her.
Hello, I'm also feel very blessed because of, I feel like Supreme just told now that due to Corona, it is possible that also from other parts of the world we can take part. And so I'm very happy that even from Germany, I can take part in this wonderful occasion. And it was very well organized. And for me, I was happy that like 5 years ago, I got the book of glimpses of wisdom from Vaidya-Bhushan, Raghavan Tirumulpad, and I was happy now to hear more in his spirit and to take part on this, because if there would not have been Corona, then it would not have been online, then it would not have been perhaps in English. So it was also a great thing. And I feel also very happy about the way how it was conducted. Like several of the Vaidyas I know for a long time, but it was in a special way how the discussion then was taking place. And I think it gives also encouragement for us to put good questions, to ask good questions, and to find a new solution, or to let the knowledge be looked at from different angles. And so it was a very beautiful time with me. So in my Ayurvedic clinic also, which I'm having here in Germany since more than 20 years, I try to shift the patients to other times because we have another timing here than in India, like the 4.5 hours time difference. And so I try to be there as most as possible. And I'm looking forward to see also some of the recordings afterwards. It's not great that you have recorded. And yeah, my pranams, thank you very much.
Thank you, ma'am. Thank you so much. And there is a one hand raise from G. Om Prakash. Doctor, please unmute and share your feedback, your opinion.
Namaste all. Gurubhyo Nama. I feel very fortunate to listen to sessions from eminent scholars from all over India. And also, actually, my learning, I think I need to share my learnings. I'm practicing since 10 years. Now I can't tell I was practicing because my views have changed a lot. Because generally I feel our students, maybe the initial practitioners, we are collecting few details from different parts of books, and we are trying to practice with the details which we have studied. I think it's not enough, because we should see the Mula Siddhanta in our practice. Without understanding our diagnosis and treatment and the process of consultation through the Mula Siddhanta, it is impossible to apply it in a different condition, in a different patient. There, the importance of Mula Siddhanta is, even I was grazing like a cow in different parts of the Tantra, but not studying one at all. I think after 10 years, I think it's late, but I think it is okay. I have started to learn Ashtanga Hridaya with the help of our Prasad sir through Siddhanta Sameeksha recordings. And also, I feel very happy to learn Nidhanasthana also now through Vagbhata Sameeksha. I'm very thankful to Prasad sir especially, and I'm very thankful for the foundation to organize such a beautiful sessions with eminent scholars, and the discussions were very nice. I'm very happy I was very fortunate to see the discussions in the chats, and the timing was very good in the morning. It is very best time to learn. And I didn't miss any class in the morning, but I couldn't attend all the sessions in the evening. Hope this will continue, and I would like to continue the learning in any way which is possible. And it's very good. I'm very fortunate, and thank you. Sri Dhanvantarim Rakshatu. Dhanyavadaha.
Thank you, Om Prakash. And there is a hand raise from Vaidya Rashmi M. Rashmi M, Vaidya Rashmi M. Please continue.
Hello, can you hear me, sir?
Yeah.
I'm always thanking the Tirupati Foundation for giving me an opportunity in this wonderful and blessed evening, because I want to tell a few words regarding Sameeksha. Here, Nidhana Sameeksha is much awaited discussion since I have started studying Ayurveda, and structure of Sameeksha also have given so many opportunities, like two experts discussing the points, and one discussant giving the way to the discussion, and all the delegates are clearing doubts. The chat box was very active during all the discussions, and so many doubts have been cleared. But apart from that, there are many eye-opening discussions which will surely be an inspiration for all new generation. And as I said earlier, as it is in the online platform, we are very glad to hear also see the union of non-Keralites with us, and we have seen many stalwarts in the Ayurveda from other than Kerala, and also in the delegates. So many Keralites are there, and also they have shared their experiences. And I have a simple and humble request that we all stay together, because we all work together for pouring the Ayurveda Amrita, that is Ayurveda Amritanam, for making the best out of it for the goodness of the whole world. For Vasudeva Kudumbakam, Ayurvedo Amridana, and Namaste. Thank you.
Thank you, Rashmi ma'am. Now I think the time is running. We shall get into the conclusion session. For that, first of all, I call upon. I would like to invite Vaidya K. Murali sir, who is the managing trustee of Tirunelpadu Foundation, to give a conclusion note and a take-home message from the Tirunelpadu Foundation side. Sir, please, sir. Murali sir.
Respected Jayakrishnan sir, Ravishankar Pervaje sir, and Dr. Prasad, Dr. Om Prakash, and dear friends. So the 10th Vagbhata Sameeksha is nearing conclusion. This 7-day program was designed in such a way that in the morning session we had the Swadhyaya and in the evening conversations on Sarvaroga Nidana. The topics were arranged in such a way to cover all the important subjects related to Roga Vijnana. And because of this pandemic situation, it was arranged in an internet platform. So we thought of adding something more than the regular way of recitation and interpretation of the text. Also, it made us a chance for reaching out a national or even international audience. Also make it possible. This was made possible because of this technology. Anyway, it worked well and we could share and discuss the ideas with so many fellow physicians of Ayurvedic fraternity. This inspired us and we are planning, as announced, a monthly, I don't know whether it is announced by Dr. Prasad. We are planning to have a monthly program of discussion. And this is planned on the second Sunday evening of every month. So for this communication, we have collected the WhatsApp numbers from all of you so that we can be in touch with. For sharing the notifications on programs, so we may have a WhatsApp group. Thank you for the interest shown in our program and thank you for your participation and discussion. It is really an encourage for us in the future programs. The message actually is Swadhyayal ma pramaditavyam. Don't deviate from textual study. With this, I retire. Thank you. Thank you.
Thank you, Murali sir. Thank you so much. Now, I invite Vaidya M. Prasad sir, who is a trustee of Tirunelpadu Foundation, to give a conclusion note and to talk about the way ahead of Foundation to our delegates. Sir, please, sir.
Respected Murali sir, Jayakrishnan sir, Pervaje sir, many other senior Vaidyas, Vinod Kumar sir, and other delegates who are regularly following the sessions in the last 7 days. And I was just remembering our Gurunathan on this special occasion. He was such a wonderful person, such a legendary person who lived his words to 100%. He was, for many reasons, he was fascinated by the Gandhian philosophy, Gita, then all other activities related to the propagation of Gandhian philosophy, like the Khadi Pracharanam, Hindi Pracharanam, then propagation of nature cure principles. And he was into it exactly like what Gandhiji told. His life was his message. He never contradicted in his professional life and his personal life. he was exactly what he talked. So that was such a wonder that we very rarely see in our day-to-day life or in our society, to be very frank. And he always insisted on the application of basic principles of Ayurveda. I would say the darshanam, the logic, the fundamental principles of Ayurveda to the practice. I think this very rarely happen actually these days. That is why the young generation especially have a very deep feeling that practice and theory are entirely different stuffs. It should not be like that. I still remember those days when many students from different colleges of Kerala and outside used to come assemble there in Chalakudi in our Guru Griham and sit on the floor to see him treating patients, then explaining the principles behind the prescription and the importance of Agni given in all the prescriptions. And he never used to go for a third item in his prescription. 99.9% of percentage of his treatment was limited to 1 or 2 medicines, if possible 1 or to the maximum 2. And that was working wonders, because he always insisted on the correction of the lifestyle. He always used to say that the treatment should be more corrective than curative. I'm emphasizing on all these points because we are missing these basic links in our day-to-day practice. He wrote one book called Putropadesham. Actually, that was written as if a message to his son, Dr. K. Murali, once he was joining to the maybe the teachership in the government Ayurveda college. But actually, it was a message to all the practicing Vaidyas, especially the young Vaidyas in disguise. In that Putropadesham, which is a very small, collection of, authored by he himself, no doubt, collection of poems, he was emphasizing, he was highlighting, or he was showcasing what are the basic things that a Vaidya should always keep in mind. And that was not just the act that every preacher is supposed to do. He was doing all these things in his own life. Down to the earth, he always asked, he always insisted on the 3 basic tenets of that being humble, simple, and modest. And he repeatedly reminded the students that don't take anything for granted. And one of his favorite quotes always was, Tasmad sadyapi nirdeshe kuryaduhya swayam dhiya, and vina tarkena ya siddhi yadricha siddhireva tad. And this also he tried to put into practice. I saw him for 20 plus years in his close vicinity. And I'm a witness to see him evolving as a sattvic soul from maybe a more agitated phase of his younger, mid-life period. And that was reflecting in his treatment also, in his prescription also. At one point of time, he was thinking about why can't we limit our prescription to 3 medicines? Of course, we may feel it like a little bit exaggeration, but he was seriously thinking about it. And the logic was very simple. We have only 3 Rogamargas in our body. And if this Rogamarga, one particular Rogamarga, and all the avayavas, srodhas, organs, or whatever it is, which is connected to one particular Rogamarga, has got something in common, definitely one medicine working in a particular Rogamarga, in a particular Vyadhi, is supposed to work in all other Vyadhis of that particular Rogamarga. So if we do not have a fourth Rogamarga, why should we go for a fourth medicine in our prescription or in our practice? So he was seriously thinking about it. He was not joking. And during his formative period, he was directed by a sage at that time that you should learn Ayurveda in such a way that at the end of the day, you should be able to practice with maybe 20 plus herbs available in your immediate premises. And he took it very seriously. He was trying to put this into his practice. He never took it as a joke. So such a person, and who spent actually a gross lot of time in his life to teach, even in the worst time of his life in terms of health, he was ready to teach a student, whoever comes from wherever he is. So that was the commitment that he was showing. And all the Shishyas, including me, have taken it as a serious engagement in their life that they have to pay back for whatever they have gained from their Guru, which is known as Guru Dakshina in our tradition. So Vagbhata Sameeksha is a Guru Dakshina, foundation itself is a Guru Dakshina, all the activities of foundation is a Guru Dakshina, and that is why we are here for the last 7 days. And I think if one teacher has taught a student at least one letter, even with the wealth of the entire universe, you cannot pay back. So your life is supposed to be a Guru Dakshina for the Guru, for whatever you have learned, no doubt. And as far as Vaidya is concerned, a Guru is initially an aim and secondarily a challenge. Aim because he is supposed to touch the status, the standard of his Guru, and the challenge because he is destined to take the message of his Guru further forward. You are not supposed to reach up to the level of your Guru. You have to take the message of your Guru further forward to the world, to the masses. So that way Guru is a challenge. So as disciples, as learners, as seekers, as students, we are supposed to take our Guru first as an aim, a target to touch, and then as a challenge to take him further forward and to make his message Yugana Rupa Sandarbham. So Vagbhata Sameeksha is again an attempt to make that challenge a reality. That is why we are planning n number of programs, even though without any formal office. Actually, the foundation is a virtual body. We don't have any formal office. We don't have any formal officers. Of course, there may be some names in the paper, but everybody is doing, everybody who volunteers to be a member of the foundation is a self-claimed member of the foundation, and they can start doing his work or her work. When we were celebrating the 100th birth anniversary of Gurunathan, there were many programs, real programs, not virtual programs, all around the state in Kerala, and the local Shishyas were taking initiative to conduct the program and deliver it. There was no central coordination for that. So that is the way we operate. And I wholeheartedly welcome on behalf of the foundation all of you to be a part of this great noble mission and take the message of our Gurunathan further forward and make sure that the world at large is benefited by his vision and mission. As Murali sir told, we have concluded the Vagbhata Sameeksha on the 7th evening today. And we had 2 types of sessions, one the Swadhyayam in the morning, and now this Sambhasha, which was an experiment. Say, going away from the conventional way of PowerPoint presentations on a structured talk, we designed it as in the form of conversation, the Sambhasha Shaili, and we are really happy to know that it was a successful experiment. We had the wholehearted cooperation from legendary Vaidyas like Jayakrishnan sir and Pervaje sir and many others in the previous days. And I'm pretty sure that they will be with us in the future endeavors as well. Thank you, Jayakrishnan sir, Pervaje sir, and all other legendary Vaidyas once again from the bottom of our hearts. And we have decided to continue this exercise of Sambhasha in the future also, as Murali sir told. We plan to have the Sambhasha between two legends mediated by one discussant once in every month on the evening of the second Sunday. So I expect all of you to be there with suggestions on new topics to be discussed, with active participation on each Sambhasha. And we have many other activities in the pipeline. We have one publication in Malayalam called Vaidya Samvadam. You can subscribe it, and you can share your numbers, names to Tirumulpadu Foundation, so that you will be updated with all future activities of the foundation. So I hope that with this concluding ceremony of Vagbhata Sameeksha, we are all blessed. Let there be showering of blessings from all the Guru Parampara, from Chadurmukha Samarambha, Vagbhadacharya Madhyama, and Asmadacharya Paryandam. So with these words, I conclude. I do not know, I took some extra time, sorry for that. And with warm regards once again to all the legendary Vaidyas in Guru Smarana, I retire. Thank you.
Thank you, sir. Thank you for the heartfelt, inspiring words. We are obliged with your and Murali sir's guideship. Now, I would like to call upon Ms. Renuka for a vote of thanks, expressing the vote of thanks from our side. Ms. Renuka, are you there?
Hello, sir. Am I audible?
Yes, you are audible. Yeah.
Okay.
Please
Namaskaram. Namaskaram to one and all. I consider this opportunity as a big blessing and honor to be part of Vagbhata Sameeksha 2020 and to propose a vote of thanks to this valuable and extraordinary session. About today's session, it was an extraordinary and thought-provoking, eye-opening session about the topic Rogamarga and exploration. The session helped in deeper understanding about Rogamargas, what are Rogamargas, and how can we apply it clinically. I'm getting into my duty. On behalf of Tirumulpadu Foundation, Chalakudi, I extend my sincere thanks to Vaidya Jayakrishnan sir for sharing his beautiful insights and thoughts about the topic. Thank you so much, sir. And I also heartfully thank Vaidya Ravishankar sir for his enlightening words and clinical experience on the topic. And I extend my sincere thanks towards Vaidya Sethu sir and Vaidya Prasad sir, who carried out the session as discussions. And next, I extend my sincere thanks towards Vaidya Murli sir, Vaidya Prasad sir, Vaidya Om Prakash sir, who concluded the session and gave this opportunity. Last but not the least, before winding up the session, I would sincerely thank all the other Vaidyas and delegates who participated actively in the chat box as well as in the session. And thank you all. Thank you so much, sir.
Thank you, Renuka. Thank you. Now, I think 7 days, the great 7 days is coming to an end. I thank all the great souls, the experts, the resource persons, the discussants, and the delegates, all of you. Once again, thank you once again. And we expect, as Prasad sir said, there is no formality, there is nothing. It's only volunteership. You all are welcome in this, what we can say, Jnana Yajna, we can say. I welcome you all once again to the family, the Tirumulpadu Foundation family. With that, I retire. Thank you. See you again. Namaste.